We're going to review the proper driveline dressing change procedure. It's important that before you start that you give your hands a good hand washing so your hands are nice and clean before you begin, and also that your work area is cleared off completely and cleaned before you get started. Once you're ready, you're going to take your driveline dressing kit and you're going to open up the kit. You're going to remove the kit from the packaging and you can dispose of the packaging. When you open the kit, be sure you only touch the outside corners. You're going to open 3 of the corners till your kit looks like this. Once your kit is like this, you'll see you have masks and gloves. The first thing you'll do is apply a mask for you and place one on the patient. It's important to make sure you have a good cover and that the mask is on appropriately. So you want to make sure that it covers the chin and gently pinch the top of the nose so you have a nice seal around. If there's anyone else who's going to be in the room with you while you're doing the driveline dressing change, make sure that they also are wearing a mask. You're next going to place the clean gloves on. Once you have your clean gloves on, you're going to remove the old dressing. You're going to start at the site farthest from your anchor and gently, starting from the outside, remove the adhesive. You're going to gently pinch, lift, and pull down and remove the dressing. At this time, it's important to take a look at the exit site. So you're going to look where the driveline leaves the body. You want to make sure there's no redness, swelling, or any drainage. If you know any of these signs or symptoms, make sure you let the LVAD team know. You also want to use this time to take a look at the old dressing and see if there's any drainage located on the old dressing. Once you've removed the old dressing, you can take this and dispose of it, as well as your clean gloves. We're now ready to continue opening the kit. Again, make sure you're only touching the outside corners. Everything that's inside here is completely sterile, so you want to make sure you don't touch inside there and contaminate anything. You're next going to remove your sterile gloves. This is done by pinching the center of the gloves, lifting them up and moving them completely outside of your sterile field. You'll next open the packaging of the sterile gloves, starting with the middle here and pulling them completely open. You're first going to place the glove on your dominant hand. You'll take your non-dominant hand and lift the cuff portion of the glove. Using your second hand, you'll take your dominant hand and sneak it into the glove. To pull this down, make sure you're only touching the portion of the glove that is going to be going against your skin. Once you have your first glove on, you're going to use this glove to pick up the second glove. You're going to sneak your hands into the cuff portion, so it's like this, and again, you want to make sure that you're working above your area so you're not contaminating these gloves. You then take your non-dominant hand and you'll sneak it into the glove and pull this down. At this time, if your fingers have not been adequately placed, you can now use your gloves to touch the other glove and fix anything that you need to. It's very important that once your gloves are on that you don't touch anything else, because now you are completely sterile. These gloves should not touch the patient, you shouldn't touch yourself. Make sure that you're very conscious of where your hands are at all times. Once your sterile gloves have been placed, it's now ready to proceed. You're ready to proceed with cleaning the driveline site. You can reach into your kit and you're going to grab the first ChloraPrep stick. You're going to activate the stick by pinching these sides. You'll hear a click, and what you're doing is you're allowing the liquid that's in this stick portion to pour down into where the sponge area is. To clean the driveline site, you're going to start at where the driveline exits the body. Starting at the center, and you're going to do small circles, working your way around. Gently sneaking underneath the driveline so you're cleaning all the way around. Once you've cleaned all the way around, you're going to dispose of your first ChloraPrep stick. It's now time to grab the second stick, and you're going to repeat the same process. You're going to activate, allow the liquid portion to enter the sponge area, and you're going to proceed with the same procedure that you just did and clean this site. Of note, make sure that your other hand remains visible and you don't touch anything, and you're making sure you're maintaining and keeping it clean. So again, you're going to do your small circles around, gently cleaning underneath the driveline site, starting at the center and working your way toward the outside. Once you've repeated the exact same sets that you did with the first ChloraPrep stick, you're now going to clean the driveline. You're going to start closest to where the device exits the body. You're going to do one swipe down the driveline, and do the same thing by lifting up and then cleaning each side of the driveline. Then you'll dispose of the stick. At this time, it's very important to make sure that you allow the skin to completely dry to prevent any irritation. You're next going to go back to your kit and you're going to remove the gauze. There's some extra items in here that you will not need. We're going to use the split gauze. As you can see, there are 4 here. We will only use 2. So you're going to grab 2 of the split gauze. When you take the split gauze, the opening of the gauze is going to go in the direction of where the driveline is. And you're going to fold into thirds. You're now ready to take your dressing. The kit I'm using has bordered gauze. The dressing may look a little bit different depending on which kit you're using, but the process is going to be the same. You're going to remove the adhesive backing and place the first one on top of your gauze. It's very important to gently press all the way around and make sure you're creating a nice tight seal. You're going to repeat the same thing with the second adhesive, but you're going to overlap so you're completely covering the entire driveline. And again, make sure you're pressing all the way around, creating a nice tight seal, and gently pinching by where the driveline is so it's completely covered. At this time, you've completed the driveline dressing. You can remove the masks at this portion, but it's very important that before you leave the patient's bedside, that you make sure that you secure their controller around their waist by using the provided belt.